Hello friends, I am Dr. Dinesh Kumar Mishra, Professor Pharmaceutics, College of Pharmacy, IPS Academy, Indore. In this lecture, we will deal with an interesting topic, parenteral formulations. Here, we have a look on highlights of this episode. Introduction of parenterals, pre-formulation factors, routes of administration, water for injection, pyrogenicity and non-aqueous vehicles. So friends, let's begin our today's episode. We start with module 1, that is introduction part. The word parenteral is derived from Greek word that is para-enteron, that means beside the intestine. Parenterals are types of sterile products which contains therapeutic agent and free from viable microorganisms. Simply, parenterals are the products which are administered other than oral routes. Parenteral preparation or injectables are the sterile solutions or suspensions of drug in aqueous or oily vehicles meant for introduction into the body by means of an injection under or through one or more layers of the skin or mucous membrane. Parenteral preparations are sterile preparations containing one or more active ingredients intended for administration by injection, infusion or implantation into the body. They are packaged in either single dose or multiple dose containers. Now the question arises, what is the need of parenteral products? Although oral route is the most preferred route for drug administration, but in certain circumstances parenteral route is desired. Conditions like patients suffering from severe dehydration or electrolyte depletion, for example diarrhea and vomiting. In these cases, to restore fluid and electrolyte quickly, electrolyte solutions are given IV. Second one, patients who cannot eat like unconscious or coma patients or undergone surgery of GIT. IV administration of vital nutrients like amino acids, glucose, minerals, vitamins are needed. Third one, in case of uncooperative or uncontrolled patients like seizures or psychosis, drug is administered through parenteral route. Another one is to elicit necessary local effect like local anesthetics for minor surgeries. Another one is where self-medication is not possible and to ensure patient compliance. Another condition is in emergency conditions like hypotension, arrhythmias or bronchospasm. Another one is for drug administrations those are poorly absorbed from the alimentary canal or gastric content degradation. Now we move towards classification of parenterals. It is classified first one based on types of packaging. They may be single dose units, for example MPUs, infusions and pre-filled disposable syringes. Second one is multiple dose units, for example multiple dose vials. Classification, another one that is based on the volume of product. It may be classified as small volume parenterals, also known as SBPs, in which volume of product is less than 100 ml. It is classified as large volume parenterals. It is known as LVPs, in which volume of product is equal or more than 100 ml. It is classified based on application also. They are known as solutions for irrigations, ophthalmic solution, dialysis solution, diagnostic agents, allergenic extracts, implants. They are also classified based on type of formulation. They may be sterile solutions, they may be sterile suspensions, they may be sterile emulsions, they may be sterile solids. Broadly, sterile preparations are classified into two categories, small volume parenterals and large volume parenterals. SBPs, according to USP, they are classified or they are defined as an injection that is packaged in containers labeled as containing 100 ml or less than, known as SBPs. USP categorize injections into following categories: solutions ready for injection, dry soluble products ready to be combined with a solvent just prior to use, suspension ready for injection, dry insoluble products ready to be combined with a vehicle just prior to use, emulsions, liquid concentrates ready for dilution prior to administrations. Now what are LBPs? According to USP, single dose injection that is intended for IV use and is packaged in containers labeled as containing 100 ml or more is known as LBPs. Although FDA has defined LBPs, a terminally sterilized aqueous drug product packaged in a single dose container with a capacity of 100 ml or more and intended to be administered or used in man. It includes IV infusions, irrigating solutions, peritoneal dialysates and blood collecting units with anticoagulants. LBPs are mainly preferred for water electrolyte supplement, nutrient supply, correction of acid-base balance in body as plasma expander to promote diuresis as dialyzing agents in patients with impaired kidney functions. Now we will talk about what are the advantages of the parenteral formulations. First one is quick onset of action, suitable for the drugs which are not administered by oral route. It is useful for unconscious or vomiting patients, useful for patients who cannot take drugs orally, and also useful for emergency situations. Apart from advantages, it possesses certain disadvantages. For example, first one is pain on injection, difficult to reverse and administer drugs effects, sensitivity or allergic reaction at the site of injection, and requires strict control of sterility and non-pyrogenicity than other formulation. And only trained persons is require specialized equipment, devices and techniques to prepare and administer drugs, and they are comparatively more expensive and costly to produce. Now, what are the general requirements of these parenteral formulations? It requires sterility, freedom from microbial products like toxins, pyrogens, isotonicity, freedom from physical and chemical contaminants, matching of specific gravity with body fluids. Now we will move towards next module, that is module 2, pre-formulation factors. Pre-formulation, it is the study of physical and chemical properties of drug before formulation. The pre-formulation research is associated with analytical and pharmaceutical investigations that both precede and support formulation development efforts for all dosage forms. These investigations are carried out under stressed conditions of temperature, humidity, light and oxygen, so that the reactions are accelerated and potential reactions can be identified. There are various physicochemical properties which affect a drug substances are given below. First one is color. It's a property of intrinsic chemical structure of drug which highlights intensity or unsaturation level. Intensity of color depends on the extent of conjugated unsaturation and the presence of chromophore groups like CO, NO2 and NH2. Certain saturated compounds also demonstrate color due to minute traces of highly unsaturated, intensely colored impurities and or degradation products. Most of these compounds tend to generate color during highly stressed conditions of heat, light and oxygen. Generally, a considerable color change becomes a limiting factor to the shelf life of a parenteral product, even before a considerable change in chemical stability is noted. Another parameter is odor. A new drug substance odor is examined by carefully smelling the headspace of the drug container, which has been formally closed in order to allow concentration of volatiles. The occurrence and description of any odor is noted. Another one is molecular structure and weight. Molecular structure and weight are the basic drug characteristics which must be determined. With the help of molecular structure, potential properties and reactivities of functional groups can be studied. Another parameter is particle size and shape. Microscopic evaluation by using a scanning electron microscope or an optical microscope with polarizing attachments can be used to determine these characteristics. From the comparison point of view with the expected batches, the drug morphological characteristics should be recorded either by a sketch or more precisely by a photomicrograph as everlasting evidence. The drug's crystalline and amorphous properties can be determined by using a polarizing microscope. Another parameter is thermal analytical profile. A thermal profile may be exhibited when samples exposed to changes in temperature, environmental during synthesis and isolation. It is recorded when the sample is heated between ambient temperature and its melting point. The basic technique used to study this phenomena is known as differential thermal analysis, DTA. Melting, fusion, crystalline structure changes such as polymorphic transitions, boiling, sublimation and dissolution are few examples of endothermic transitions characteristics that can be determined with this technique. Differential scanning calorimetry, DSC, it is another technique that is similar to DTA. Another technique is thermogravimetric analysis, TGA, which is used to detect the existence and stability of solvated drug molecules. Next parameter is melting point. The melting point of a substance thermodynamically can be defined as the temperature at which the solid and liquid phases are in equilibrium. Determination of melting point, it's a key indication of purity, since the presence of relatively small amounts of impurity can be detected by a lowering and widening in the melting point range. Another parameter is hygroscopicity. It is the phenomena of moisture absorption by compounds under specific conditions of moisture and humidity. Drug substances' physical and chemical properties can be badly affected by high degree of hygroscopicity and making it pharmaceutically difficult or inadequate to work with. These studies are conducted over a range of humidity conditions relevant to the general laboratory and manufacturing areas as well as uncontrolled storage environment. The study is carried out by taking accurately weighed samples of compound into tiered containers and placed at different conditions of humidity for time periods up to 2 weeks. Any gain or loss in weight is measured at predetermined intervals until equilibrium is reached. If the drug substance is found to be very hygroscopic or determined to be unstable in the presence of moisture, the drug would have to be stored under dry conditions and worked under low humidity. Compounds are grouped according to hygroscopicity classification as given below. Class 1, non-hygroscopic at relative humidities below 90%, essentially no moisture increases occur. Class 2, slightly hygroscopic at relative humidities below 80%, essentially no moisture increases occur. Class 3, moderately hygroscopic at relative humidities below 60%, moisture content does not increase above 5%. Another class is class 4, very hygroscopic at relative humidities as low as 40 to 50%. There are chances of moisture. Another parameter is solubility. Solubility is of prime importance for developing solutions that can be injected either intravenously or intramuscularly. Generally, solubility is a function of chemical structure. Acid or basis salts represent the class of drugs having the best chance of attaining the degree of water solubility desired. The analytical method used for solubility measurement may vary according to the drug moiety. In any drug structure, if unsaturated conjugation is present, enabling it to absorb visible or UV light, spectrophotometric analysis can be performed. Another activity is optical activity. It is the phenomena of rotation of plane polarized light by a competent compound. If the compound rotates the beam of light to the right or clockwise or by an angle, the material is said to be dextrorotatory, and if the compound rotates the beam of light to the left or anti-clockwise direction, the material is said to be levorotatory. Another parameter is ionization constant. The pH dependent solubility of a compound can be determined from the ionization constant, also known as pKa. The degree of ionization of an acid or base is studied by the ionization constant of the compound. pK is determined by potentiometric pH titration or pH solubility analysis. Another parameter is partition coefficient. The partition coefficient P is a measure of lipophilicity of a compound. It can be measured by determination of the equilibrium concentration of a drug in aqueous phase and oil phase held in contact with each other at a constant temperature. It can be expressed as P is equal to concentration in oil divided by concentration in water. Now friends, we will move towards another module, module 3, routes of administration. Parenteral routes of administration mainly include 3 primary routes which are commonly employed: intramuscular, subcutaneous and intravenous. To a large extent, these 3 routes satisfy the 4 main reasons for administering parenterals, like for therapy, for prevention, for diagnosis and for temporarily altering tissue functions in order to facilitate other forms of therapy. Under special circumstances, other routes are also employed for parenteral administration. Now we will move towards one by one. First one is intravenous route. Intravenous, it is the route of administration in which injections or infusions are administered directly into the vein. It is one of the most commonly employed routes for the purpose of administration of drugs. Fluids or electrolytes, large volume up to 1 liter can be administered by this route. It is very convenient for administration of large volume of fluids rapidly. The general indications for this route are to ensure distribution and delivery when hypotension or shock exists, to attain an instant pharmacological response, especially in case of emergency, to restore fluid and electrolyte balance quickly, to avoid complications occurred with other routes, to treat serious life-threatening infections or conditions, to provide continuous nutrition when patients are unable to fed by mouth. Next route is intramuscular route. In this route of administration, injections are injected directly into the body through a relaxed muscle. It is the most convenient route accessible for both the administrator and for the patient, especially for children. A common site of administration for this route is deltoid muscle of the upper arm, in which 2 ml can be injected. More than 2 ml up to 5 ml can be injected into the gluteal muscle of each buttock. This route provides a means of sustained release of drugs formulated as aqueous or oily solutions or suspensions. This route is preferred in comparison to subcutaneous routes when a rapid rate of absorption is required, and over the intravenous route when the drug cannot be administered directly into the vascular compartment. Although this is an easy route of administration, precautions are taken to avoid the entry of injections to blood vessels, especially an artery, which might lead to an infusion of a toxic agent or toxic vehicle directly to an organ or tissue. Another route is intradermal route. This route is also known as intracutaneous route when the injection is given into the dermis, which is situated just beneath and adjacent to the epidermis, is called intradermal. Absorption by intradermal route is very low. The volume of injection administered through this route does not exceed 0.1 ml. Various diagnostic agents, vaccines and antigens are usually administered through this route. Another route is intra-articular route. The route by which infusion or injection can given to the synovial sacs of different accessible joints is known as intra-articular route. Corticosteroids, lidocaine and antibiotics are mostly administered through this route for infections, inflammations, pain or other problems resulting from inflammatory diseases. Certain agents are administered in a single injection, whereas some other agents like certain antibiotics are given by continuous infusion and bathing of the joint. Next route is subcutaneous route. In subcutaneous route, injection is given into the loose connective and adipose tissue beneath the dermis. This route is mainly preferred when the drug cannot be administered orally because of various reasons like inactivation of the drug by the GIT or lack of absorption, or if the patient is unable to ingest medication by mouth. In comparison to the oral route, drug is more predictably and quickly absorbed by this route. But when compared with the intramuscular route, absorption and predictability is less. Injection volume does not normally exceed 1 ml. Generally, insulin, vaccines, narcotics are administered by this route. Next route is intraperitoneal route. The route of administration where the injection or infusion is given directly into the peritoneal cavity by a needle or indwelling catheter or directly into an abdominal organ like kidney, liver or bladder is known as intraperitoneal route. This route is mostly employed to treat local or widespread intra-abdominal disease, to dialyze and remove different toxic substances from the body. Another route is intra-arterial route. When injection or infusion is given into an artery which leads directly to the target organ is known as intra-arterial route of administration. This route is employed generally for the purpose of injecting radiopaque substances for Röntgen graphic studies of the vascular supply of various organs or tissues. Next route is intracardiac route. When injection is given directly into the chambers of heart, it is called intracardiac route of administration. Under abnormal situation and during certain emergency circumstances like cardiac arrest, where the drugs have to reach the myocardium quickly, intracardiac route may be used. Precautions must be taken to prevent heart muscle, coronary arteries or conducting systems from damage by the trauma of an injecting needle or by the drug injected. We will move towards another route, that is intracisternal route. When injection is given directly into the cisternal space surrounding the base of the brain, it is called intracisternal route of administration. This route is mainly useful for diagnostic purpose. Now move towards another route, that is intralesional route. In this route, injection is given directly into or around a lesion, usually located in or on the skin or soft tissues, to achieve a therapeutic effect. This route is effective in case of a potential local effect. It is useful in neutralizing various toxins like tetanus. A similar therapeutic usefulness has been assured for rabies with direct injections of antisera into and around the site of the bite. Another route is intraocular route. In this route, injections are given directly into the eye cavity. There are 4 types of intraocular injections which are as follows. First one is anterior chamber. Injection is given directly into the anterior chamber of the eye. Next one is intravitreal. Injection is given directly to the vitreous chamber of the eye. Another one is retrobulbar. Injection is given around the posterior segment of the globe. Next one is subconjunctival. Injection is given beneath the conjunctiva so that the medication diffuses through the limbus and sclera into the eye. Another route is intrapleural route. In this route, injection is given into the pleural cavity. It is known as interpleural route. If dwelling chest tubes are inserted surgically, this route may be used for irrigation purposes or for repeated drugs injections. In certain situations like infections or malignancies concerning the pleural cavity, mainly where the disease causing impaired respiratory functions are treated by this route. Next route is intrathecal route. In this route, injection or infusion is given directly into the lumbar sac located at the caudal end of the spinal cord. This route is employed for the diagnostic purpose, then for the therapeutic purpose. The treatment frequently comprises of injecting or infusing a suitable chemotherapeutic agent into the lumbar sac and depending on the weight of the substances injected, tilting the patient to encourage distribution over the hemispheres. Another route is intrauterine route. In this route, injection or infusion is given through a needle inserted percutaneously into the pregnant uterus. It can also be used for delivering calcitonin and insulin. Usually after the 16th week of pregnancy, injections or infusions of certain substances like saline 20%, prostaglandin E or urea are given to induce labor in medical abortions or to deliver a stillborn fetus. Another route is intraventricular route. When injection or infusion is given directly into the lateral ventricles of the brain, it is called as intraventricular route of administration. It is applicable in the cases of infections or malignancies involving the membranes and the cerebrospinal fluid, that is CSF, surrounding the central nervous system, CNS. Before moving towards module 4th, friends, I would like to suggest you please visit our website www.cec.nic.in for further reading and learning and more topics associated with your B.Pharm syllabus. Here you will find many lectures, e-contents, LORs and many more. Hope this site will be catalyst of learning for you. So friends, now move towards next module. Module 4, vehicles. Solvents and vehicles must meet special purity and other standard to assure sterility, stability and safety. Vehicles should have specific characteristics which are given below. It should be pharmacologically inert, non-toxic and compatible with blood, maintain solubility of the drug, physically and chemically stable, it does not affect the pH, it must be pyrogen free, it should not contain any particulate matter and the finished product must follow sterility standard. Solvent system used for parenteral preparation are of two types. They may be aqueous vehicles, they may be non-aqueous vehicles. First we will talk about aqueous vehicle. The most preferred aqueous vehicle is water for injection. Now what is water for injection? That is also known as WFI. It is highly purified water which is purified by distillation or reverse osmosis and may not contain added substances. WFI need not to be sterile but must be pyrogen free. The pH of water for injection is between 5 to 7. According to USP, total solids content, it should not be more than 10 parts per million. It is prepared by two processes. First one is distillation. What is distillation? It's a process of conversion of water from a liquid to its gaseous form. It also known as steam. As steam is highly pure gaseous water, hence all other contaminants in the feed water are removed. There are two basic types of WFI distillation units. First one is vapor compression still and next one is multiple effect stills. Now another one method is reverse osmosis. As name is suggesting, the natural process of selective permeation of molecules through a semi-permeable membrane separating two aqueous solutions of different concentration is reversed. Pressure 200 to 400 psig is applied to overcome osmotic pressure and force pure water to permeate through the membrane. Membrane is usually consists of cellulose esters or polyamides. Now what about the storage and distribution of water for injection? It is stored in tight containers at temperatures below or above the range in which microbial growth occurs. Normally this temperature is 80 degrees centigrade. It should be used within 24 hours following its collection. The water must be collected in sterile and pyrogen free containers and regularly checked for quality assurance as specified in official monograph. Another aqueous vehicle is sterile water for injection as WFI. It is water for injection which has been sterilized and packaged in single dose container of not greater than 1 liter. It must be pyrogen free and may not contain any microbial agent or other added substances. Another aqueous vehicle is bacteriostatic water for injection, BWFI. Bacteriostatic water for injection is sterile water for injection consisting of one or more suitable antimicrobial agents. It is packaged in pre-filled syringes or in vials containing not more than 30 ml of the water. The label must mention the name and quantity of the antimicrobial agent present. Another vehicle is sodium chloride injection. It is a sterile isotonic solution of sodium chloride in water for injection. It contains no antimicrobial agent. Another one is bacteriostatic sodium chloride injection. It is a sterile isotonic solution of sodium chloride in water for injection containing one or more suitable antimicrobial agents. Another aqueous vehicle is Ringer's injection. It is a sterile solution of sodium chloride, potassium chloride and calcium chloride in water for injection. Now friends, we move towards next module, that is module 5, pyrogenicity. What is pyrogenicity? It is the conditions or the extent of being pyrogenic. Now what are these pyrogens? Pyrogens are products of microorganisms' metabolism. Most bacteria, molds and viruses have been reported as producing pyrogens. The gram-negative bacteria generate the most potent pyrogenic substances as endotoxins. Pyrogens are lipid substances chemically associated with a carrier molecule, which is usually a polysaccharide but may be a peptide. Its effect into men after 1 hour injections are a marked rise in body temperature, chills, body aches, cutaneous vasoconstriction, rise in arterial blood pressure. Generally, antipyretics eliminate the fever but not the other systemic effects of pyrogens. The fever response to pyrogens in rabbits, it is the basis for the official pyrogen testing. Now what are the sources and elimination of pyrogens? Pyrogens may enter a product by any means that may introduce microorganisms or the products of their growth. The most likely sources are water, contaminated solutes and containers. Water may be free from pyrogens if it has been distilled so that the condensed molecules have gone through the vapor state protected from inadvertent contamination and if the distillate has been collected and stored in a sterile conditions. Now what about solutes? Solutes can be pyrogen free if it is prepared from vehicles free from pyrogens and stored in a manner designed to prevent subsequent contamination. Containers may be rendered free from pyrogens by adequate cleaning and heating, usually as 210 degrees centigrade for 3 to 4 hours or heating at 650 degrees centigrade for 60 seconds. It destroys pyrogens. However, autoclaving temperatures do not destroy pyrogens during a normal cycles. Pyrogens sometimes can be removed from solutions by adsorption on the surface of selective adsorbents. Selective solvent extraction methods are also useful in the production of antibiotics where heavy pyrogen contamination results from the fermentation process. Ultrafiltration, a newly developed process that is very promising for pyrogen separation and elimination. It is better to prevent pyrogenic contamination than to attempt to remove pyrogens. Now we will move towards another vehicle, that is non-aqueous vehicles. It is sometimes required to eliminate water completely or partially from the vehicle because of solubility issues or hydrolytic reactions. A great care must be taken for selection of non-aqueous solvent. It must have some desirable characteristics like it must be non-toxic, non-irritating and non-sensitizing. It must not exert any adverse effect on the components of the formulation. It must be highly pure. It must have suitable physicochemical properties like density, viscosity, miscibility, polarity, stability, solvent activity and toxicity. Basically, there are two types of non-aqueous solvents. First one is water miscible solvents and the second one is water immiscible solvents. Now what are these water miscible solvents? Those solvents which are usually miscible with water and used in combination with water known as water miscible solvents. Examples of water miscible solvents are dioxylanes, dimethyl acetamide and beta hydroxyethyl lactamide, butylene glycols, polyethylene glycol 400 and 600, propylene glycol, glycerine and ethyl alcohol. Another solvents are water immiscible solvents. As name is indicating, these are the solvents which do not miscible with water and hence not used in combination with water. For example, fixed oils, ethyl oleate, isopropyl myristate and benzyl benzoate. The most widely employed non-aqueous solvents are polyethylene glycol, propylene glycol and fixed oils. Now friends, it's time to summarize our talk. Sterile products are dosage forms of therapeutic agents which are free from bival microorganisms. Chiefly, they include parenterals, ophthalmics and irrigating preparations. Among these preparations, parenterals are unique because they are administered through the body defense mechanism, skin or mucous membranes in two internal body compartments. These preparations must be free from any kind of microbial contamination and toxicity, and they should offer exceptionally high level of purity. Broadly, parenterals are classified into small volume parenterals and large volume parenterals. For successful development of any formulation, pre-formulation factors must be considered. The intended route of administration has a greater impact on the parenteral formulation. The volume in which a dose of the drug must be encompassed is also a factor to be considered. Solvent system must have specific characteristics and meet specific purity and standard to ensure sterility, stability and safety. In summary, this module will help students to understand about need of parenteral formulation, types of parenterals, pre-formulation factors, routes of administration and solvent system.